Hello, and welcome to the ASCO Daily News Podcast. I'm Geraldine Carroll, a reporter for the ASCO Daily News. Today, I'm delighted to welcome Dr. Jhanelle Gray. She is the Department Chair of Thoracic Oncology and co-leader of the Molecular Medicine Program at the Moffitt Cancer Center. She's also a professor at the University of South Florida Morsani College of Medicine and chair of the 2022 ASCO Annual Meeting Education Program. Dr. Gray will tell us about the hot topics and must-see educational sessions at this year's annual meeting. Dr. Gray's full disclosures are available in the show notes, and disclosures of all guests on the podcast can be found on our transcripts at asco.org/podcasts. Dr. Gray, it's great to have you on the podcast today.
Thank you for having me. I am excited to be here with you today and for the opportunity to chat with you about the upcoming ASCO 2022 annual meeting and the educational sessions.
Well, the theme of the annual meeting is Advancing Equitable Cancer Care Through Innovation. Can you tell us how equity and innovation are reflected in the education program? And what would you say are the must-see sessions in this year's program?
I am excited about sharing and hearing the latest advances in our field so we can move toward impact, innovation, and equity across our global cancer care community. Many of the sessions that we have, the attendees will join us either online or in person, and really will help us come together with the common goal of reducing the cancer burden. The presidential theme from Dr. Everett Vokes has really helped us to formulate what these sessions are. A few of them I can think about that I think really align with where we want to go for this 2022 ASCO meeting are things such as looking at strategies to advance cancer equity in our cancer clinical trials. We also have sessions such as artificial intelligence in oncology, the field currently and where it is headed. And this touches on our innovation piece. We also have some really keynote speakers, such as a session, our ASCO Town Hall, moderated by Dr. Monica Bertagnoli, a past ASCO president, and she'll be talking to us about the future of the conduct of clinical trials after COVID-19. I hope this gives you a sense of the exciting topics we have as we work to identify and address, again, the challenges in this global cancer care field.
A couple of other sessions that are really trying to address these challenges are two joint sessions. So I'd like to ask you about those. The first one involves ASCO and the American Association for Cancer Research, or AACR. And the second one features ASCO and the European Cancer Organization, ECHO. Can you tell us about the topics of these sessions and why you think it's important for participants to see these particular sessions?
Thank you. That's a great question. And thank you to AACR and ECHO for their engagement and collaboration in planning and designing these sessions. We work to ensure that both organizations, priorities, and expertise are truly represented. The ASCO AACR joint session is titled The Promise of DNA Damage Response and Repair in Cancer. And the ASCO ECHO joint session is on HPV vaccination, prevention, and treatment. These sessions include hot topics in oncology and were planned intentionally with a common approach, that is, across DNA damage repair and HPV vaccines. We really want the audience to hear what is the existent data from which we can learn from. How do we work to expand upon these gains across various tumor types? And what are those key opportunities to expand platforms? And this should include diagnostics and therapeutics across global populations. Overall, I think that both of these sessions will help the audience again understand not only what is present day data, but also learn where these fields are heading in the future.
Thank you. Well, the ASCO Voices session is a favorite of the annual meeting. The speakers this year from Nigeria, Ireland, Germany, and the United States will share personal stories focused on equity, global health, and innovation. I've had a chance to interview the speakers, and their stories really capture the human spirit and convey a true desire to find innovative ways to improve the lives of patients and survivors. Is this session one of your favorites at the annual meeting?
Absolutely. The ASCO Voices is truly a compelling session. It helps to highlight where we should focus and what can seem like a very busy meeting. It helps all of us, including healthcare professionals, industry partners, caregivers, to take that breath and recenter. Our focus is ultimately the patient, and these personal stories help to cross-cut that oncology continuum. We have, of course, chosen those that help to showcase and support the importance of the presidential theme. And you'll see that many of those have topics focused on issues that are most relevant to global health, innovation, and/or cancer equity. So congratulations, and looking forward to all of the speakers in this session to hearing their talks.
Dr. Gray, is there anything else you'd like to add before we wrap up the podcast? Do you want to mention maybe some of the sessions that are on top of your list to attend?
Absolutely. So we have also, in addition to the educational session, you'll hear from others throughout these podcasts on the scientific sessions. Also, obviously, looking very much forward to the plenary, looking forward to the awards ceremony also. And it's just been an absolute pleasure to have been working with Dr. Sonali on the scientific sessions, as well as obviously Dr. Everett Vokes, our current president.
Well, thank you very much, Dr. Gray, for being on the podcast today, and thank you for your work as chair of the 2022 ASCO Annual Meeting Education Program.
It's been an absolute pleasure to spend time with you today. If I can also take a moment to thank the ASCO staff, just what a phenomenal team. And to those that are listening, I look forward to seeing you, hopefully, some of you at least in person at the meeting.
Wonderful. And thanks to our listeners for your time today. If you're enjoying the content on the podcast, please take a moment to rate, review, and subscribe wherever you get your podcasts.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.